All right, so what's causing you to have a UTI, urinary tract infection? So, of course, there are certain things that we need to look at. Number one, hormonal changes. Are you in menopause? Of course, you're going to have a UTI, right? Because of the hormonal change that has occurred there. And number two, because of the dry vagina that comes with that. Number two, are you pregnant? If you are going to be pregnant, listen, when you are coming in pregnant with UTIs, it's not a surprise, right? Just get treated with pregnancy-safe antibiotics. Because why? Because of the hormonal change that occurs in pregnancy. Number three, talking about hormones, are you on contraception? If you're on contraception, 3 months, it doesn't matter. As long as it's hormonal, just be prepared for getting UTIs, right? So no one must be surprised when you have UTIs. And, of course, what's this thing? And you are using contraception that has hormones. Coming out of that, we're also going to touch on pH changes, right? So what can cause a pH change? When you like douching or steaming down there, you understand? Don't steam. Like I've said before, it's not a steam bread. It's not a steam bread down there. So why are you steaming it? You understand? You want to steam it as if it's like a dumpling. No, don't do that. You understand? And of course, don't insert things, fruits and yogurts. I don't know what you guys do down there. You understand? Perfumes. Imagine taking some perfume that you are spraying. Don't do that. You understand? I mean, this is nature. You understand? Yeah, it's supposed to, after some long day, it's supposed to bring some smell down there. You understand? Yes, there's a healthy smell and there's an unhealthy smell. You see? So don't do that. Just use water there. You understand? Don't use a soap that says kills 99% of bacteria. We don't want that. You understand? Because bacteria, we have good bacteria and we have bad bacteria. If you use something that kills 99.9% of bacteria, it's going to kill the good bacteria as well there. And hence you develop stuff like BV, bacterial vaginosis, which is an overgrowth of bad bacteria, where the bad bacteria take over. You see? So you don't want to don't do some pH changes down there. Wiping. You understand? Don't wipe from back to front. No. You must wipe away. You understand? Yeah, you must wipe away there from the state of Virginia. You see? Yeah, wipe away. You don't want to take the things that came from number 2 and you take them to number 1. No. Number 1 must always, be number 1. You see? Yeah, don't mix it up with the losers and stuff like that. You see? And then of course, it depends on, the type of underwear you're using. If the type of underwear you're using, it doesn't allow for the fruit down there to breathe. Woosah, bad boys what? Yeah, if it doesn't allow for that, then I'm telling you, so it's recommended sometimes to use cotton underwear there so that it can breathe nicely. You see, so those are some of the things that can cause you to have a UTI. And the most important, long-term use of antibiotics. Guys, antibiotics, they are very good and they're a blessing in healthcare. But if they are abused, then, you can't blame the antibiotics. You must blame the user and the one who's dispensing. You see? Yes, because even the user will go to different doctors seeking antibiotics. You understand? So be careful of that. Long-term use of antibiotics. Unnecessary use of antibiotics. You see? That will cause, because those antibiotics will go down there. They won't just, they will destroy everything. The good bacteria and the bad bacteria. And remember, they won't just destroy for your vagina then, because the vagina has a normal flora. It will also destroy for the gut as well. It destroys everywhere. Remember, you have good bacteria everywhere. You understand? So don't do that, my people. You see? So when you at least follow some of these principles, you will then prevent you having a UTI. You see, of course, using public toilets and all of these things. I mean, those are just some of the risks that you can encounter in having UTIs. You see? And then, of course, if your man, his thing is sick. And remember, with men, sometimes they don't show symptoms, but the thing is sick. The stick is sick. Is that a rhyme? The stick is sick. Do you get it? If you don't get it, forget about it. Yeah. So if the stick is sick, then I'm telling you, understand, you will also have those issues. So at least if you can note what can cause your UTI, right, with some of these things, hormonal changes and all of those things, then you understand. If you are pregnant, you have to say like, I know, they told me it's normal. Just go in so we can treat, because we don't want you to have issues with your pregnancy and miscarriages and stuff like that. You see, if you're on contraception, unfortunately, just know, because of that, hormones, whatever, you might have issues with UTIs. Just come and get treated. You see? So, yeah, it's about risk and benefit. You see? How about you?